I'm Avani V, volunteer at Shivi Forensics. I am here to present a PPT on the topic postmortem changes. Postmortem changes are the changes that occurs in our body after death. It includes immediate changes, early changes, and late changes. Immediate changes are the changes that occurs in our body immediately after death, which includes stoppage of brain activity, stoppage of circulation, stoppage of respiration. Stoppage of brain activity in hospitals, we know it is measured by EEG, electroencephalogram, and in stoppage of circulation is usually measured by ECG, electrocardiogram. Stoppage of respiration we can in normally we measure like touching our nose by our fingers, but it is not the right way to measure the rate of respiration, such as some people can hold their breath for 10 minutes, like if he is a certified swimmer or like some other profession, like if he's a yoga practitioner. So as a normal person is concerned, we cannot fix a man's death by touching our nose by our fingers. So it is important to consult a medical professional before we say that the person is dead. Early changes includes changes in the skin. His skin looks like more like a pale and ashy white appearance, which is termed as pallor mortis, which is sets in our body after 15 minutes of death. After 15 minutes, our skin color look like more pale or ashy white appearance. In case if the body has some wounds, changes may occur, but healing won't occur after death, since all the cells of the body has died. Changes in the eye. Eye loses its shine and initially congested and looks swollen. And one of the characteristic feature of the eye is tachynoia. It is an ocular sign of death in which a reddish brown discoloration is transversely arranged across the sclera, which typically forms after 3 hours of death. There in eyes also we can see Kevorkian signs, a postmortem change in the retina that occurs when the blood vessel break up into segments. Then comes cooling of the body. It is a characteristic change that occurs after death. It occurs when, since all metabolism comes to a stop, the body thermoregulatory systems stop working, the body's temperature begin to drop, and it reaches the temperature around the surroundings. It usually starts 30 minutes after death. It can last up to 48 hours, but it usually complete within 18 to 20 hours. Then comes the liver mortis. It is also known as PM lividity. It is the intense bluish purple or purplish red discoloration which appears after death on the most dependent parts of the skin due to the collection of blood in the capillaries and the small veins such as rete mucosum of the most superficial layer of the dermis due to gravity. It appears in 0.5 to 2 hours as mottled patches. 4 hours it is developed like a sheet, but it is not fixed, it can move easily. After 8 hours, fixation occurs. Then the changes occur in the muscle. After death, all the muscle of the body, which includes voluntary, involuntary, and cardiac, passes through 3 stages: primary relaxation, or it is also known as primary flaccidity; rigor mortis; secondary relaxation; secondary flaccidity. Primary flaccidity, it is a complete relaxation of the muscle in the period immediately after somatic death. Somatic death means cell death. After cell death, the entire body passes through primary relaxation. After primary relaxation, rigor mortis sets in. It is a temporary stiffening of the muscle that occur after death. It is caused by the chemical changes in the muscle that result from the lack of adenosine triphosphate ATP molecule. As we all know, it is the energy reservoir. It occurs after 12 hours of death, retain in the body for the 12 hours and slowly disappears in the next 12 hours. After 36 hours, secondary flaccidity kicks in or appears. Secondary flaccidity, it is a complete relaxation of the muscle after rigor mortis has passed away. It may be due to autodigestion or putrefaction, like that. Then comes the late changes. Late changes include decomposition. It has 2 components, autolysis and putrefaction. Autolysis. It is the process of self-digestion of the cells and tissue in the body after death. Since it is a chemical process, it is accelerated by heat and slowed by the cold. It is also known as autodigestion. Then comes putrefaction. Putrefaction is due to the fermentation by bacteria. After the death, the bacterial flora of the gut spread throughout the body, producing putrefaction. As we all know, our gut has some good bacteria. After death, it spread throughout the body, producing putrefaction. It has some external phenomena like greenish discoloration of right iliac fossa, RIF. This is the earliest sign of putrefaction. Occurs in 8 hours in summer and 36 hours in winter. It occurs when cecum contents are in a fluid state and full of bacteria. Greenish color is due to the formation of a compound called sulfhemoglobin, which is in greenish in color. Then comes development of foul smelling compounds. Foul smell from the cadaver is mainly due to the production of cadaveric alkaloids and cadaveric putrescines. Skeletonization. Skeletonization is the last stage which in postmortem changes. Like it is the final stage of decomposition in a dead body when the soft tissues have decayed and the skeleton is exposed. There are several factors that affect rate of skeletonization: access to air, acidity of soil and soil water, amount of soil water, climatic and seasonal variation. It usually requires 3 weeks to several years for a body to completely decompose into a skeleton, depending upon the factors such as temperature, humidity, presence of insect and submergence in the substrate such as water. If the body is buried to the surface of the earth, it can the rate of skeletonization will be less comparatively, which is buried in the inner core of the earth. Then comes the adipocere or saponification. These are the modifications that occurs in a body after death. It is a modification of putrefaction in which friable, crumbly, water insoluble grayish white to brown wax like material is produced in a dead body by the breakdown and the conversion of body fats into fatty acid like palmitic, stearic, hydrostearic, oleic acid. Fats are converted into fatty acid which is accumulated like a friable, crumbly, water insoluble grayish white to brown wax like material is produced in the dead body itself. Adipocere is formed when bacteria break down fat in the body. It can form in any environment and can take a little as 3 weeks or as long as 3 months to form. Adipocere can make it difficult to estimate how long the body is dead. The estimation of time since death is difficult when adipocere is formed. Then mummification, in which it is another modification. We can see that in Egypt there are mummified bodies like in which skin become brittle, contracted, dried, firm, leathery, tough, parchment like, shrunken and wrinkled, turning yellow to brown to black in color. Mummification requires dry, warm environment with a constant breeze. Example: ancient Egyptian mummies, Chinkoro mummies, Guanches mummies are all example of mummification. Next, these are the reference that I used for this PPT making. Thank you.